Resample is a European project that focuses on people with COPD. The goal of Resample is to develop a technology that supports patients and caregivers. This technology will help patients manage their COPD and other chronic conditions. In the end, we want that Resample is useful and will be used in practice. But how should the Resample technology communicate with people with COPD? To answer this, we asked people with COPD to take part in an interview. In this interview, we focused on utilization of health data, risk prediction, and on the use of a virtual coach. Rusing Research and Development created an interview guide, which was then used in 3 countries, in the Netherlands, Italy, and Estonia. This was very important because there could be differences between the cultures. In total, 21 people with COPD participated in the interviews. We started the interviews with asking people with COPD whether they agree or disagree with 4 statements. We found different opinions between the different countries on only one statement. In all countries, most people agreed with the statements on the left, that gathering your own health data is important to monitor complaints, and that it is important to have access to the health data gathered by the healthcare professional. Furthermore, in all countries, most thought it is not difficult to receive the requested health data from the healthcare professional. However, when we look at the statement on the top right of the screen, we found differences. In the Netherlands, most people disagreed. They don't necessarily trust the health data received from the healthcare professionals more than the health data gathered by themselves. They have the same trust in the data gathered by the healthcare professional and the data gathered by themselves. When we go to Italy, we see that most agreed with the statement. They do trust health data from the healthcare professionals more than their own. And in Estonia, half of the people agreed and the other half disagreed with the statement. The reason why people agreed was because the healthcare professionals are the experts, and the ones who disagreed have the same trust in the data gathered by healthcare professionals and gathered by themselves. In the second part of the interview, we showed the participants several mock-ups of how the future Resample technology could look like. We asked them to go through those mock-ups and give us feedback about this. In all countries, the first impression of most people was positive. They thought it looked intuitive for collecting health data, was easy to read, and they also thought that using this technology could improve the visits to the healthcare professional, as you can easily share your health data with them. However, they also gave us valuable feedback and ideas which we can use for the development of the actual Resample technology. For example, to add some explanations to figures that display their health state, or to also show averages of their physical activity of the past months. After these mock-ups, we continued with the topic of predictions about their health. We asked them how they feel about receiving predictions about their health. The opinions were divided. Some people were positive about this, as they thought that they can learn from this or that they can prepare themselves for making changes in their lives. But participants also thought that it is not possible to predict their health. So they were a bit skeptic about this as well. The topics participants wanted to receive predictions about differed across the countries. In all countries, participants wanted to receive predictions about dyspnea and health in general. Furthermore, in the Netherlands, they wanted to receive predictions about their age, about weather, and about their well-being, as well as about their COPD symptoms in 10 years. Other topics mentioned during the interviews in Italy were predictions about exacerbations, physical activity, and fatigue. For Estonia, these were also predictions about exacerbations and furthermore a bad mood and diseases you are prone to. The last part of the interviews focused on virtual coaching. Participants received mock-ups of a conversation between the virtual coach and the technology user. They could read this conversation and were then asked for their first impression. They mostly had positive responses and thought their coach could be useful for several goals. For example, for adapting their lifestyle, for improving their mood, or for raising awareness about their physical activity. In the Netherlands, participants mentioned that virtual coaching would be specifically beneficial for people newly diagnosed with COPD. The reason for this was that those people have a lot to learn about, for example, what's good for them and what's not. Although several possible areas for improvement were mentioned, participants were positive about the future resample technology and the possible benefit it brings. The results of this study showed again how valuable it is to involve future users in the whole development process of a technology. We again learned a lot from the participants. They are the experts when it comes to living with and managing COPD. Their input helps us to develop resample in such a way that it really supports people living with COPD in their daily care. The development of the resample solution is ongoing, and we will continue to involve end users so that we get feedback at different points in time. Only then we can make sure that we understood well what people need and that our technology is well developed. Would you like to be involved and think along with the resample project? Please feel free to contact us. Thank you so much for your time and attention, the resample team of Roosing Research and Development.